So thanks a lot. Thanks for letting me be part of your evening today. 5 years ago, I came to Ohio State University from the National Institutes of Health, or NIH, which you see there on the left. And when I was at the NIH and still at Ohio State University, I've had 3 areas of clinical research interest. And I'm going to talk about concussion tonight, as Peter said, because of the venue you're at. But there's 2 other areas I'd be delighted to talk to anybody about. One of these areas is a study of patients that are genetically predisposed to develop tumors of their brain and spinal cord that can develop multiple tumors over their lifetime. And this is, you see here, this large red tumor in a spinal cord of a young girl that we're removing, but you also see that arrow showing that another smaller tumor developing in one of these cancer syndromes. And we study these because we want to better understand the biology. These don't just occur in families that have these genetic predispositions. They can occur in any of us, and we're looking for new ways, non-surgical ways to treat these better. Another area I study outside of concussion is drug delivery to the brain and spinal cord. Drug delivery is the biggest limitation to treating the majority of neurologic diseases that we have that are ineffectively or not treated at all today. And so colleagues and I, several years ago, developed a way to directly deliver drugs into the brain or spinal cord of patients and image that distribution of drug. And I'm going to show you a video of a young girl who had a malignant brainstem glioma. We're doing MRIs as we're infusing that drug, and you can see where the drug now is going in that white area. So we can selectively treat areas, and we're looking at a number of first-in-man trials for brain tumors, Parkinson's disease, Alzheimer's, as well as epilepsy. Well, since we're in Paul Brown Stadium, as mentioned a few times before, I want to talk about my third area of interest. It's been work I've done with the National Football League, or NFL, and that's concussion. And as many of you know, concussion is caused by a hit to the head. Doesn't mean another person. It could be an inanimate object. It could be the ground. Anything that causes a hit to head can cause a concussion. Concussions are associated with neurologic signs and symptoms. They could be a headache, nausea, blurred vision, memory problems, any of those types of things. And in concussion, these problems are transient. In adult athletes, they disappear 90% of the time within 7 to 10 days. My interest in concussion started about 7 years ago when Roger Goodell, the then commissioner and current commissioner of the NFL, called myself and several of my neurosurgical colleagues, 3 other neurosurgical colleagues across the country, to be part of a NFL head, neck, and spine injury committee. And our major charge was to better understand head and spine injury, particularly concussion, and ways to mitigate concussion's effects moving forward. Now, none of us received compensation for it, but we were all compelled as surgeons and neurosurgeons dealing with head injury. All of us have children that are involved in contact sports, so we felt it was really an opportunity to change concussion, not just in football, but across a number of spaces. As you all know, concussion is not just a football problem. Concussion occurs in every sport. In fact, if you take equestrian sports, there's a 250-fold higher risk of a concussion per episode than there is playing football. In fact, the most common method of concussion or play with concussion in youth is riding a bicycle. Most concussions do not occur in sports. In fact, they occur in daily life, and so concussion is definitely not just a football problem, and by no means just a sports problem. Nevertheless, the NFL has been the most challenged of any sport, group, or organization to understand concussion and mitigate concussion. So 7 years ago, when this committee formed, we looked at 4 strategies to reduce concussions and its effect. And that was changes to the rules of the game, legislation, education, and research. And so I'm just going to briefly show some examples of ways that we were able to impact concussion in football and beyond. First of all, let's start with rules changes. We evaluate data every year on what causes concussion. And when we looked at what plays cause concussion, we were stunned by the fact that nearly a quarter of all concussions occur during the kickoff. Yet kickoffs only take place in less than 8% of plays during an NFL game. It suggested that there was an opportunity to reduce that. So some of you remember in 2011, the kickoff line was moved 5 yards forward. The number of touchbacks increased significantly. In fact, this data just shows in the green lines after the rules change, nearly a 40% decrease in kickoff returns because of touchbacks. That resulted in over 40% decrease in concussion on kickoffs. Another area we looked at is what causes concussion. Helmet-to-helmet contact over 52% of the time was the culprit involved in concussion during an NFL play. And I'm going to show a clip of helmet-to-helmet concussion to kind of give you a sense of why this is a problem. Is there sound?
The neck or above, and that was a dead-on helmet-to-helmet.
So that clip is part of a larger video shown to educate players on helmet-to-helmet contact. That, along the education, along with new rules and stiffer penalties for existing rules for helmet-to-helmet contact, including fines and suspensions, have dramatically changed the landscape, reducing the helmet-to-helmet contact from 2012 to 2016 of 40%. Concussions occur in practice as well, contact practices. To reduce the number of those concussions in contact practices, the NFL limited the number of contact practices to 14 across the entire season, the strictest among all football at all levels. What that resulted in was a 33% decrease in concussions during practice. We know legislation, national and state, can impact understanding of concussion and improve safety. This is Zach Lysted. In 2006, he was playing youth football, hit his head on the ground, had a concussion, came out, was returned to play, had another concussion, developed a large hemorrhage over his brain, was taken emergently to University of Washington for removal of that clot. He was left with cognitive and physical disabilities, and he continues to improve to this day. But through the courage of him, his family, his surgeons and physicians at University of Washington, along in conjunction with the NFL, they passed the Zach Lysted law in 50 states. And what that law does is prevent players, youth players, from returning, if they're even suspected of having a concussion, back to the field and avoiding what we call these second impact syndromes, the bleed over the brain after you get a second concussion, and these are unique to youth athletes. The other part of that law doesn't allow these athletes to return until they've been seen by a concussion expert and for further play that season and beyond. That has had a dramatic impact on that second impact syndrome that Zach sustained. Another area, as I mentioned before, is education. The NFL and the CDC partnered to develop informational posters that are free. 1.5 million of these have been downloaded and are now posted in locker rooms across America. The education contained in these posters permits athletes now to recognize concussions when they're having them, or their teammates to recognize concussions in their teammates. What that's resulted in is players self-reporting concussion and teammate reporting of other teammates' concussion. This is something that rarely, if ever, happened prior to education surrounding concussion. Another area where Ohio State's been deeply involved in concussion is moms clinics. Urban Meyer, Roger Goodell, and the NFL partnered to start the first moms clinic, and this was several years ago. Over 400 moms came, and the idea was they would to provide better understanding around diagnosis, prevention, and management of concussion. These moms clinics became the examples for moms clinics now that are held around the country. So the last area we can improve or mitigate the impact of concussion is research. Now, I said before, concussions are transient in nature, and the question that always comes up is, so why are we concerned about them? Concussions can cause pathologic changes in the brain, and I think you've all heard about these. Chronic traumatic encephalopathy is the potential pathologic changes, or CTE. There's a brain on the right that has CTE, and you can see it's shrunken or atrophied by the dark grooves that you see within that brain. Now, CTE is only a pathologic diagnosis. You can't diagnose it in a living individual. CTE has been attributed to many clinical findings that you hear about in the news: depression, suicidal ideation, dementia, forgetfulness, as well as aggression. Some of you may remember Junior Seau. Junior Seau was an all-pro linebacker for 20 years with the San Diego Chargers. He tragically committed suicide several years ago. His family requested that I oversee the analysis of his brain, and we did it in a way that created a paradigm for research within CTE moving forward, and that was to bring multiple experts from different institutions to look at the brain in a blinded fashion before making the definitive diagnosis. We were also able to image his brain with very high resolution MR images in the hope that someday, if we continue to do this with these types of individuals, that we can find MR markers that we can use to predict if someone has CTE and look for ways to treat that moving forward in living individuals. The NFL and its partners have given over $100 million in the last few years for research, looking at biomarkers, prevention, new materials to prevent and improve safety. They've partnered with the U.S. Army, with GE and the Head Health Initiative, Under Armour, as well as the National Institutes of Health. Most recently, at Super Bowl 51, they did 3 First and Future awards, looking at ways to, again, mitigate and diagnose concussion. One of the winners was WinPack, developing new helmets, safer helmets. One of the founders is Sean Springs. Probably all of you know who Sean Springs is. Played at Ohio State and then went on to an all-pro career with the Seattle Seahawks and then the Washington Redskins. The Ohio State's also involved in a research collaborative that's not part of the NFL. It's through the NCAA with Big Ten teams in the Ivy League. They're looking at ways to collaborate and enhance concussion prevention as well as management. So I know all of you are Buckeyes fans. How is OSU interacting and interfacing with all of this? They're doing it in a very aggressive, positive way. Urban Meyer has been a great collaborator in understanding some of the features we just talked about. Contact practices are going to be reduced in half. We have neuro consultants on call in the stadium at every game for spine and head injury. We have review meetings where we look at every single concussion in practice or during a game every season to look for additional ways to prevent or improve safety. And finally, we discuss research on a regular basis so that we always are at the cutting edge of concussion management. So in concluding, I'm incredibly proud of what our committee has done with the NFL in managing concussion. I just showed you an example of a few ways, by no means all the ways that have been changed in the last few years. And I'm deeply appreciative of all of you here tonight, the OSU community and the Ohio State Wexner Medical Center, for allowing me to do various types of research that I explained to you before, as well as concussion. So thank you very much.